This weekend, the public and private health sectors, organised labour, business and the community, as well as faith-based organisations are joining forces in the Vooma Vaccination campaign. The aim of the campaign is to mobilise members of the public to get vaccinated against COVID-19. Now, to talk to us a bit more about the country's vaccination campaign, we're joined by the Solidarity Fund's executive head responsible for humanitarian response and behaviour change pillars, Wendy Tlou. Wendy, good morning. Welcome to Morning Live.
Morning.
Perhaps as an introduction, can we briefly remind us what is the Solidarity Fund?
The Solidarity Fund is an organization that was formed by the president, by business, by civil society, really to be a rapid response vehicle in terms of South Africa's response to the pandemic, primarily to support the national effort in terms of the health response. So making sure that we support the health system in terms of being able to respond to COVID-19, to patients, to make sure that healthcare workers are available as the pandemic progresses. And then secondly, to provide humanitarian relief, which has been, in our case, in the form of food relief to all of South Africa through food parcels and food vouchers and farming input vouchers, and then also to respond and support the efforts around gender-based violence, which we all know is South Africa's perennial pandemic, which was exacerbated at the time of the pandemic.
Are you able to let us in on how much funds have been made to the fund so far?
We have received approximately 3.44 billion rands of funding from various contributors and donators, whether it be international foundations, whether it be members of government, whether it be corporates, and whether it be individuals like you and I who are able to donate through retail stores, whatever little we can. So over the time, in the 18 months that we've been around, we have received and collected 3.44 billion rand.
Mm-hmm. So what is your role in the vaccination drive?
So our role in the vaccination drive is really mile wide and mile deep. We have supported the vaccination drive in terms of the deposit for COVAX, which saw us receive just over 10 million doses from Pfizer. We have supported through capacitation of technical assistance to the Department of Health. We have now just recently started supporting with what we are calling surge sites. So additional vaccination sites across the country that really leverage where people are. So we have been putting up sites, temporary sites, mobile sites, roving sites in and around retail entities, especially around SASSA weekends or SASSA days where people go to collect their social grants. We have also been supporting the campaign in terms of communication campaigns, whether it be supporting community partners who are doing great work in terms of being on the ground and mobilizing communities, both in terms of vaccine education, but also explaining and responding to some of the fears and the concerns that people may have around taking the vaccine. Mm-hmm. And so it's been a lot of support that we have given to the vaccination drive.
And what is the data that you have available showing you in terms of South Africans in general, appetite to get the jab?
Actually, the research that we have access to, whether it's been UJ, whether it's been HSRC, whether it's been NICDS, shows that a large number of our population, over 70% of the population, is keen to get vaccinated and intends to get vaccinated. What we are seeing, though, and those people are sitting within what we call the movable middle. So it's people who are positive that they will take the jab, or people who are saying, yes, I will take the jab, but I still need to find out a little bit more information. I still need to be a little bit more convinced of why I should take the jab. So that's really been what we have seen. What has been a challenge, though, as you and I have seen, is that we do have early adopters that take up the vaccine as soon as it is available. And then we start to see drops in terms of maintenance and sustaining that vaccine uptake. And that's really been the focus of the work on the communication side, to make sure that we are ever present, we are consistently and constantly communicating with all manner of communities, whether they are highly intended to take the vaccine jab or still making decisions and finding out information about doing that. But the intention to vaccinate is huge at 70%. And really it's about us now converting that into people walking through the vaccine sites and actually taking the jabs.
All right. Wendy Tlou, thank you so much for speaking to us. She is the Solidarity Fund's executive head, responsible for humanitarian response and behaviour change pillars. Wendy Tlou speaking to us about the Vooma vaccination drive.